Schneck, along with many other hospitals, has limited access to the hospital. Sometimes it's just a few people. Some hospitals, it's no visitors whatsoever. We want to be careful that we protect the vulnerable patients that we're taking care of. So a hospital patient isn't like the average person on the street. They are more likely to be harmed by an infection that a person can bring into the hospital. We also want to make sure that the people who are taking care of patients can take care of them without concerns about the disease being spread around by people who are unnecessarily in the building. We know it's a hardship for families, but really I think in the end it's the smartest thing we can be doing right now. You may have had a surgical procedure that you were planning on that got canceled, an elective surgical procedure, and the reason these things are being canceled is to protect you. We are trying to make sure that we don't bring people unnecessarily into an environment where we're taking care of a lot of sick people. Also, physicians now are being increasingly occupied with the treatment of sicker and sicker people. Not so much here right now, but probably soon, and certainly in a lot of other places in the United States. So we have to be proactive, and we have to make sure that we keep otherwise healthy people out of harm's way. Unfortunately, at this point, tests are difficult to come by and they're processed very slowly. So it's a two-pronged problem. They're hard to come by and we get a long turnaround time. So what we're doing in Indiana, at least in this part of Indiana and many other parts of Indiana, is we're trying to be stricter in the criteria we use to test people. So we want to test people who are the sickest, the people who we think are likely to come into the hospital. We also are testing healthcare workers who become ill as well because they're very vulnerable since they're taking care of so many sick people. Other than that, we will probably assess you. You may have COVID-19 infection, but it doesn't necessarily mean you're going to get a test. You may be sent home and told to isolate yourself. And that's all we can do right now with the limited amount of testing we have. When will tests become available? Soon, we hope. So there are other efforts to bring additional testing in the state of Indiana, but right now, we can't say when. Well, if you're sick, if you have fever and a cough, obviously, you should call before you go anywhere. Call your doctor or call at Schneck, we have a hotline you can call. And then you'll get in contact with someone who can give you some advice. If you're really sick or if you have a lot of other medical conditions, certainly those are the people that we would most like to come to the emergency room. But if you're not sick enough, if there's something you can handle at home, call in, but stay at home. That way you'll be safer and you'll be, obviously helping others. It's important to understand that people can be carrying and transmitting this virus asymptomatically or with minimal or what we would consider minor symptoms. So the advice I give is act as though you have the virus and act as though the person you're interacting with has the virus. And if you take precautions and you distance yourself, obviously, you are going to do the best you can to prevent transmission. If you have a blasé attitude and think, oh, this isn't important, then I think you're much more likely to slip, to not pay attention, and to sort of break the rules of social distancing. There's been a lot of talk about people who are going out in crowds and say that young people particularly who are not worrying about the virus, hey, it's not a big problem, I'm young, whatever, who cares? The fact is that you have a responsibility to everyone around you. So even if you don't get a serious infection, you could give it to someone who could have a life-threatening infection. And that's a heavy weight to bear. You really need to take responsibility for all of your actions. The virus is transmitted in much the same way that influenza is. If you speak in someone's face, or you cough, or you sneeze, if you're too close, you can transmit through your mouth and nose small droplets. They're large enough that they don't go very far, a couple feet at most, and then they fall to the ground. Okay, so it's a little bit different from things like tuberculosis or measles, which can hang in the air for a long time. They can also be transmitted on your hands. So if you cough into your hands, for example, that's a good way to put a lot of virus onto your hands. So if you happen to shake someone's hands or touch a surface, you can actually transmit the virus to someone else. So it's important to always wash your hands and cover your mouth when you cough. and keep your distance. If you do those things, you'll be less likely to transmit the virus if you have it, and you'll be less likely to get it from somebody else who does. Social distancing is a term used by public health officials to describe a set of measures that would curtail the spread of disease in a group of people, within a group of people. And so things like, obviously, sporting events, schools, any time where people come together in crowds are opportunities for disease to spread. We're trying to change human behavior a little bit because the virus relies on us acting in the way we do to transmit itself between us. Social distancing also is a set of personal measures you can take, like standing 6 feet away, limiting the number of people that you personally come into contact, being careful when you're around elderly people who are particularly susceptible to infections. So it's a set of social guidelines and also personal guidelines we can follow to decrease the transmission of disease. All of the social distancing is particularly hard on some of the old folks, grandma and grandpa. If they're staying at home by themselves and really are not getting out, it is important to interface with them in some way. And I would recommend not having a whole lot of visitors go over there, because if you do that, you could very well transmit something unknowingly. It's best to have a designated person if you want to bring some food or you want to check on them. Another thing is social media, FaceTime, things like that. Really, if you can actually talk to each other and see each other, there's no way to transmit a virus over the phone. So I think that's something you should consider. But always look out for the psychological stress that can occur when we're all, hunkering down at home. It's very, very important to keep that in mind, because it's a tough time for everyone. And if your elderly relatives are in a nursing home, don't even try to visit. This is the best time, unfortunately we have to do this, but this is the best time to stay away from nursing homes. They are a particularly vulnerable population, and we want to make sure we don't bring anything in the doors there. And the nursing home probably won't let you in anyway, but keep in mind that there's a good reason for that. We want to protect them. I get a lot of questions about travel, and at this point, my answers changed a little bit from a few weeks ago. At this time, I would say it's probably a good idea to curtail your travel plans unless it's absolutely essential. If you have essential business needs, if you have other things that you have to do, fine. But as far as the family vacation for spring break, it's probably a good time to stay at home and have a family vacation at home. Save a little money, perhaps. If you go to places, tourist destinations, you may be disappointed. A lot of states have closed restaurants and bars and beaches and other venues where people congregate. So it's probably a good time to change your plans and just say it's going to be different this year. I think what I get asked most is about testing, obviously, and unfortunately that's the most difficult one to answer right now, because we just feel so powerless, and a lot of hospitals and medical centers are being blamed for that, but rest assured it's not the problem with your local hospital. The other one is, how long is this going to last? I think we're in the early stages right now, and everybody is sort of gung-ho, but I do think that some fatigue is going to set in, and I think people know that. They're not admitting it, but they're asking questions about how long will we have to do this? How long will I be out of work? And the answer is, unfortunately, we don't know. And it's an unprecedented time, an unprecedented situation, so we're just all going to have to be patient and listen carefully to our government and public health officials and trust them. At Schneck Medical Center, we are prepared. We have canceled unnecessary procedures, limited our outpatient contacts. We are ready. We have made contingency plans for screening more people, for taking care of people in the hospital and in the intensive care unit. And I think that the medical center has really been on top of its preparation. As the health officer for Jackson County, I very much appreciate what I see as a tremendous team effort by all of the shareholders in our community, all of the citizens. I've really seen people respond to these social distancing measures. Everyone is concerned, but everybody is really sort of towing the line here, and I've been actually quite amazed at everyone's efforts. And on behalf of the health department and Schneck Medical Center, I want to thank everyone for all of their efforts, everything they've done.